Hello everyone, this is Paramita. I have Avi with me as a volunteer. We are going to do a head to toe physical assessment tonight. We'll start with vital signs. I have checked his blood pressure with a manual blood pressure cuff, and I'll document it later. I've done my hand hygiene, and this is Avi little cold. I need to check his heart sound and the heart rate. Oh, 1 minute. Yeah, we also checked his breathing pattern. It is regular and normal, and I can see he's well kept, clean, and he's calm and composed. I don't see any sign of stress. Um, so, Avi, can you tell me your name and date of birth, and do you know where you are right now?
My name is Avi Powell. I am I was born on February 20, 2005, and I'm in my house.
You know what is the month?
February 2nd.
No, now. What is the current month?
Oh, the current month?
Yeah,
That's November.
right. So, so he's alert and oriented times four. Vitals are gone. Do you have any pain?
No,
Okay. Do you have any anxiety or any allergies?
no.
Okay, that's good. So, to begin with, we have done the vitals and general survey, and I need to do start with his to do assessment. I start with his head. Can you turn on me here towards me? Okay. So I have will check his face. It is symmetrical, and there is um, check his head if there's any lump, or I can also check the skin if it is there is any lesion or any skin issues or lump. There is nothing. The temperature is also body temperature is also warm. In general skin survey, you don't see any skin lesions, and the skin color is uh, according to his race. Uh, his speech is also calm and coherent, clear, so there is no issue with this, um, the speech. Um, his tongue is kind of moist, but lips are dry. Believe he doesn't drink much water, and the weather is also winter, so he got more cracked lips. Now I'm going to check his cranial nerve 5. So, can you close your eyes, and can you tell me if it is dull or sharp?
Dull, 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 dull.
One thing.
That's dull. Oh, that's sharp.
Okay. So he can figure out if it is a dull or a sharp or painful touch. Uh, I will. Can you please open your? I'll check his corneal reflex. So if I'm using the cotton, he's blinking his eyes. Um, Just can you move your jaws? Can you move your jaws left and right? So you can do that as well. Can you puff your cheeks here? Raise your eyebrows, frown and smile. So that is cranial nerve 7. This is a facial nerve, so you can move his cheeks and do the frowning and raising eyebrows. Now next I have to do his eye testing. So now I'm going to check his eyes. So look at my eyes are symmetrical. There is no redness and there's no discharge at this point. Um, do you have any pain
No.
in your eyes? But I know he wears glasses, so he has some farsightedness, or his visual acuity is less. That's what he need reading glass, that glass to adjust his um, uh, reading capacity. Now I'm going to check his cranial nerve 2, that is optic nerve, and I need to see if his visual fields are okay. There is no visual any facial dropping as such. Can you tell me if you can see my fingers? When you see my fingers, just let me know, okay?
I can see them. I can see them. I can see them. I can see them.
Okay, so we have checked his visual fields, um, and now I'm going to do the cranial nerve 3, the oculomotor, and cranial nerve 4 and 6 to check his extra ocular eye movements, and also I'll check the parla. I'm going to check his eye. Look at me. So I have checked his eyes. The parla is his eyes pupils are equally reactive to light and they're round. Can you follow my the light? So he is also accommodating his eyeballs to focus um, on the pen. I have also given him some books to read. He read it with his glasses on. So and he could read it within 2.5 feet distance. I'm going to do his check his ears. So I'll do some whisper test on both ears so that I can understand and his hearing capabilities. First, I need to see his ears. If they are symmetrical, he can move his ears, and there's no discharge. He needs to use my pen light. Do you have any pain here?
No.
Um, there's no discharge from the eyes, and I will do ask you some. I'll tell you some words, and you just have to tell me. Okay?
Tell you what.
I'll tell you the names.
Hard pizza flour.
Yeah.
Bus eraser Lego.
Okay. So that's right. You got that right. Um, And I want to do is the Rombach test. Can you just stand up and just close your eyes and try to like balance yourself? Close your eyes.
Balance my legs.
Just close your eyes and stand. So I can say he is not swiveling. So he can manage his balance. So you're all set. You can sit down. Um, so now you're going to check his nose. His nose are properly aligned in the face. Then just going to check his nose nares are like open. Can you breathe in and out? Okay, so they're open and clear. There is no discharge from the nose. Now we are going to check his cranial lobe one. So can you please close your eyes and can identify the smell of this?
It's fine smell.
Okay, this is right. And one more.
Coffee.
This is coffee. So he's right. And now I'm going to check if there are the sinuses, um, if there is any tenderness in the sinuses, maxillary sinus and frontal sinuses. Do you have any pain here?
Nope.
All right. We all set for that. Um, Now we're going to check as a throat and mouth. Um, he can breathe nicely, so his air is clear. Do you have any trouble swallowing
No.
or drinking? No. So I need to check his gag reflex. Can you open your mouth? Stick your tongue out. So I need to press the back of the padded tongue blade or spoon. So his gag reflex are present, and he says he doesn't have any problem with swallowing. Um, Now I'm going to check his cranial nerve 7, 10. The vagus nerve. Can you say ah?
Uh.
Take your tongue out. So he can say ah, and his uvula is going up and is in the midline. And now we're going to do the cranial nerve 12. This is hypoglossal nerve. So can you stick your tongue out? So it is in the midline, and can you move your tongue left and right? So he can move it. So that's also good. Um, Now I'm going to check his neck. So can you move your neck left and right, up and down? So you can move his. So I'm going to check your carotid pulses. That's good. This is good too. So it's 2 plus bounding. I don't see any. Let me see. I don't see any jugular vein distension. Now I'm going to do his respiratory assessment. Um, it says sit straight. So you can see his thorax is symmetrical, and anterior posterior dimension is 2:1. So that is normal. I don't see any skin lesions, but the skin is very dry. You need to use more moisturizers um, or something to keep his skin moisturizing. I have mentioned earlier that his respiration is normal. There's no respiratory distress noted. I need to listen to his lung sound. So just listen if they're clear. Take a deep breath. Breathe out. So his skin is his lungs are equally clear and anterior posteriorly bilaterally clear. There is no um, adventitious lung sound. Now you're going to do the cranial nerve 11. Just to see, can you shrug your shoulder? Okay. Now can you shrug your shoulder? Yeah. So he can shrug his shoulder. Can you tilt your head? Okay. So it's good. So he can tilt his. We are going to do a cardiac assessment. I need to listen to his heart sound. Yeah, so the heart sound is irregular, and um, there is no murmur. I didn't see any, heard any murmur or anything, and abnormal heart sounds. So, do you have any chest pain or anything like that?
Nope.
Chest heaviness?
Mm-hmm.
No. So now next we're going to check his gastrointestinal. Do you have any abdominal pain or anything like that,
No.
or indigestions?
No.
No. Do you have? Did you go to move your bowel today to go to
No.
potty?
Yes.
Okay. So he moved his bowel. I just need to look at his abdomen. So it is non-protuberant abdomen is um, flat. I need to listen to his bowel sounds. One quadrants. You have any pain?
Nope.
So his bowel sounds are audible. He does on all quadrants, and he doesn't have any tenderness. Um, so mm, and I didn't feel any mass on he no guarding of the abdomen as I palpated his abdomen. Uh, do you have any problem with peeing? Any trouble peeing or any pain?
No.
Okay, so he doesn't say he have any pain during yeah, peeing or micturition, and your urine color is um, light yellow.
Light
Light yellow.
yellow.
Okay, so he's all set there. And now I need to check his mm, upper extremity and lower extremities. So his upper extremities skin is warm and dry. I don't see any anomalies in both upper extremities. Um, check his pulses, brachial and radial pulses. So they are 2 plus. There is no edema. I will check your um, capillary. They are less than 3 seconds. Can you move your hand? So there is no issue with the, and you can see his muscle strength and resistance. You can push my hand. All right. So he has good muscle strength and mm, no abnormal muscle movement or jerking I have seen at this point. Now I'm going to check his lower extremities. So now I'm going to check his lower extremities as upper extremities.